Well, thank you for being here with us today. I'm Dr. Carol Tavani. I am a psychiatrist in Wilmington. What I mostly do is consultation, liaison, and forensics. But as many of you know, I've been very, very involved for many years in the whole issue of physician health and wellness, and also impaired physicians. I ran the Physicians Health Committee for the Medical Society for decades. So we're here today to recognize Physician Suicide Awareness Day. I want to thank the Medical Society for putting this on, and thank Lynn Robinson for orchestrating this little get together. Physicians sadly have a significantly higher suicide rate compared to the general population, with both men and women doctors facing higher risks. Especially women have a greater risk than men do, and than the general population. Suicide remains a serious issue within the medical community, and that also goes for dentists and veterinarians. Some statistics, an estimated 300 or 400 doctors a year commit suicide, successfully commit suicide in this country. And of course, those are only the ones we know about that are identified as suicides. You know, many go unrecognized as accidental or single vehicle, motor vehicle accidents, and the like. Men have a suicide rate about 1.4 times higher than the general population, than men in the general population. Women physicians are about twice that much. Now, that's not entirely surprising because the incidence of major depression in women, unipolar major depression, is about twice that in men. For bipolar, it's more similar. Women have an especially elevated risk, probably for that reason, and some statistics suggest about a 24 to 76% higher rate than the general population. It's very high and it's scary. And certain specialties seem to be especially at risk. Psychiatrists, of all things, and anesthesiologists. And there are probably a number of reasons for that. Anesthesia in particular have access to a number of lethal medications. Also dentists, as I said. What are some contributing factors? Well, depression is the biggie. About 15% of doctors experiencing depression will say, I've at least had the thought that maybe life is not worth living, a suicidal thought. Most people don't act on it. Unfortunately, some do. I think part of this has to do with a number of risk factors. You know, we can talk about burnout, you know, long hours, an impossible workload, being emotionally exhausted, and the pressures of medical practice often lead to these things. And I'm often reminded of some wise words of Dr. Roy Menninger, who said that the typical personality of the physician is someone who has an incredible tolerance for delayed gratification. You know, it's always the next step. You know, when I finish medical school and oh, when I finish residency, it'll be better. And then it's my fellowship, and then it's joining a practice, and it's always something that you're delaying your own gratification for. Also, we are in an impossible profession. It's often been called that. If you think about it, in medicine, there is zero room for error. You're not allowed to make a mistake. And since humans are fallible, you're going to make a mistake. Sometime you're going to make a mistake. And then the repercussions are terrible. Not only harm to the patient, but the getting sued issue is just huge. We're a very litigious society. And I think we all kind of live in fear of that. Physicians tend to be highly self-critical. You know, we're all our own worst enemy. And oftentimes we put our own self-care behind that of others. So those are risk factors. And I think that's most of us. And then untreated mental illness. Many physicians who die by suicide were not receiving mental health treatment or appropriate mental health treatment at the time, despite having similar rates of depression as non-doctors. And then we have to talk a little bit about substance abuse. Now, substance abuse rates in physicians are actually rather low, but there is a somewhat higher risk of societally accepted substances like alcohol, as opposed to illicit drugs, and also access to prescription medication. I think relationship problems, and again, malpractice, stress, and the threat of that are big issues. And those all increase the risk of feeling hopeless and like there's no way out. A huge issue is stigma. Doctors are afraid, they're reticent to seek help because of fear of losing a reputation, and also, again, of licensure risks. You know, we have the Board of Medical Practice is now called the Board of Licensure and Discipline. So that's a little scary right there. And physicians are frightened of, you know, somebody reporting them, whether it's valid or not. Most of the time, actually, the board finds that it's not valid. But there's a great fear of that, of risk of loss of licensure. And that's your identity. That's your profession. You've worked very hard for it. You don't want to lose it. How do doctors try to commit suicide? Far and away, the most frequent way is by overdose, followed by firearms. And as I said, the occasional hanging. We did have one physician we had just begun to follow. He was very reticent to accept help, and unfortunately was found having hanged himself. And I don't think any of us ever got over that. And it was preventable. He could have been helped. Some prevention strategies. I think peer support is very important. The support of your friends and your colleagues, and promoting awareness of mental health, and then trying to reduce the stigma and improving workplace environment. I think workplace environment has been a bigger issue as medicine has become more corporatized. Now, when I started out, it was a family, and I think nowadays it's somewhat less so, and I hate to see that go away. And then creating confidential avenues. Confidential is the word here for seeking help and addressing distress. Now, some of that requires changes in legislation because we have duty to report laws, and so that's very scary, and it drives a lot of problems and doctors underground. Awareness and support. National Physician Suicide Awareness Day, September 17th, is observed as a call to action for more awareness and also better support. Because if you're just aware but you don't have an avenue, then you're kind of stuck. Organizations that encourage open conversation and routine mental health check-ins. Now, if you see a colleague or a buddy who is having a hard time, reach out, pick up the phone, call them, or stop in and say, how are you doing? Or let's go have coffee and we'll talk about it. Be there for each other. It sounds hokey, but I can't stress it enough, because sometimes people will tell you later when they were thinking about, harming themselves, that call is what made the difference. And on a personal level, I have done that and I've experienced that countless times. So relationships with a trusted colleague, and then removing the barriers to getting help. This is a multidimensional issue. It involves mental health, systemic factors, personal factors. And despite, as I said, improvements in awareness, those other things represent challenges. So what are some effective prevention strategies? Well, primary prevention, taking care of yourself, is a biggie. And having a life outside medicine. So 100% of your eggs are not in that basket. And then secondary prevention means early intervention and availability of help, and make yourself available to your colleagues. In closing, I want to tell you, you are not alone. You are not alone. Help exists. Many of us are here for you, and asking is a healthy sign. You are valued and you are valuable. You have people who care. I want to ask Lynn to put up a little slide I made of some resources and numbers. You can either take a screenshot of this, or you can always contact the Medical Society. I don't know if you can see this very well, but there are numbers. There's actually a group of volunteer psychiatrists who man phones 7 days a week from like 8 in the morning to 1 in the morning. Give it a call. There's the 988 helpline. I put those numbers up here for you. There's crisis intervention line and a couple of websites. So take care of yourselves and take care of each other. Thank you very much.